Nurses and medical staff, they are on the front lines of this war against COVID-19, but many are saying that they are missing the tools they need to win. And 13 Action News reporter Austin Carter right now is live outside a medical center tonight near the Strip that is feeling a double punch tonight, Austin.
Yeah, and they are essentially quieter than ever, Todd. But here's the thing, Elite Medical Center here, they have been testing people for COVID-19. And a doctor who works here, who you're about to meet, says things haven't been that smooth. In fact, they've been having to ration their own personal protective equipment. And they say, yes, there needs to be more of these COVID-19 tests in the Valley. Tucked behind the now quiet Las Vegas Strip is Elite Medical Center, a usual hotspot for tourists who need medical care. But now doctors and staff are having to adapt to a new normal.
With the shutdown of the Las Vegas Strip and other things around the valley, we're definitely seeing a decrease in the number of patients that are coming in.
But Dr. Courtney Downs says this is the calm before the storm.
I think you are going to start to see bigger influx of patients over the next coming weeks. I'm hoping not, but I think we're trying to be prepared, making sure that we have the appropriate personal protective equipment.
And that equipment is something that hospitals and medical centers have been fighting to get. Dr. Downs says they're not sure how they're going to increase supply, so they're rationing what they have.
You need to keep your staff safe, because if we're not there and we're not healthy, how are we going to take care of other people?
There's also a struggle to get their hands on tests. Governor Steve Sisolak saying yesterday that the CDC and FDA told his office there's an indefinite backlog when it comes to test kits.
Previously, I put in 4 requests for COVID-19 tests. None of them have been filled.
On the nation's capital, President Donald Trump announcing today over 1 million Americans have been tested for the coronavirus, more than any other country, he says. And for treatment,
we actually worked to secure 30 million tablets from Sandoz and 1 million tablets from Bayer of hydroxychloroquine and chloroquine, which are potential COVID-19 treatments.
But Governor Sisolak recently signed an emergency regulation to limit prescriptions of the 2 drugs to prevent hoarding. Dr. Downs says both drugs will not be prescribed for people to self-medicate or prevent them from getting COVID-19, but will be reserved for serious cases.
The increase in volume of the medication is so that way, if we do start to see the increase in patients within the valley, we have the appropriate medication, so that way we can treat patients who need to be hospitalized.
So where will these supplies come from? Well, we know that Governor Sisolak did launch that coronavirus relief task force. And just today, we've learned that they've accumulated hundreds of thousands of surgical masks, gloves, and other medical equipment. Certainly, Valley doctors, nurses, and other medical staff will be awaiting those deliveries. Reporting live, I'm Austin Carter, 13 Action News.
Well, Austin, thank you. And also,